And now, a Buddy Check 13 reminder with News 13's Amy Hoyt.
Hi, everybody, and welcome to 13 Now. I'm News 13's Amy Hoyt, and today is your Buddy Check reminder, where we remind you to check for lumps in your breast on your own. And if you find something, go see your doctor right away. And of course, once you hit 40, to start getting those annual mammograms, because of course, finding that in advance is key to a long life after that and getting the proper treatment. One of the doctors you'll see when you go for your mammogram is a radiologist, and one of the very best in Bay County is with us for our interview today, and I'd like to introduce her to you, although you probably may recognize her, Dr. Lindsey Weintritt-Davis from the Women's Imaging Center at Bay Radiology. Hello, Dr. Weintritt-Davis. How are you?
I'm great. How are you?
I'm good. We've done this a time or two, but it has been a little while.
Yes, ma'am.
And some things have changed and some things haven't. So we're going to pick your brain and find out what it means to get a mammogram.
Okay.
All right. So let's start with, I turned 40 and I have no family history, let's say. What do I do?
So we recommend that all women start yearly annual mammograms at age 40, like you mentioned. And so that would be if you're asymptomatic, have no particular problems, just coming in for your screening, would be a screening mammogram. And that you just need a referral from your doctor for them to order it and make your appointment. When you come in for that appointment, you have a quick exam, usually takes about 10 to 15 minutes. And then when those results are available, that will let you know if everything is clear. You get to wait for a whole year, or, are there some other issues that we need to address?
Ladies that are in there, pardon me, are very professional when you go in. But, if you've never had one, it can be a little awkward maybe, but they are so sweet and so kind.
Yes.
What is their role? Like, how do they do that? And what did they study to become the person who helps you get the mammogram?
Right. So the mammographers or mammography technologists are highly trained and specialized. They start by becoming X-ray technologists, and then they do additional training to be certified to do mammography. And that training is so important because the quality of that examination really determines, what I am able to see. They do apply some compression to the breast. So when you come in, you'll be asked to undress. They place the breast, on the X-ray machine, and they apply a bit of compression, and that's very important to get high quality images. It's not everyone's favorite part, but it's very quick, and it is very tolerable. It's a pressure sensation. It's not terribly painful, and it really only lasts a few seconds. And they'll do that in a few different positions, and it's really important that they include all of the breast tissue on the image, because if they don't pull the entire breast into the film and include that, then I can't see it. And, cancers that are close to the chest wall or close to the underarm could be missed. They are doing you a favor when they are getting a high quality examination, and they take that very seriously. They're, like you said, highly trained professionals.
Right. And they're always so kind when you're in there. We talked about getting it at age 40. Do women get those earlier if there's a family history?
They can. That's a great question. So the rule that we use for family history is for your first degree relatives. That means mother, sister, or daughter. So you start at age 40 or 10 years younger than your earliest family member. So say your mother had breast cancer at age 45. We'd want to start screening you at age 35. And same, for your sister. So, and then there are some other scenarios, women who have a known genetic mutation, like the BRCA genes. There are also several other now, but BRCA is sort of the most well-known. Those women we like to start screening at age 30. And sometimes a bit younger. So it's become more personalized now. We want to have that conversation, start having those conversations about your particular risk with your family history and any potential genetic concerns in your 20s, so that we make sure we have you on the right screening pathway at the right age.
What about breast density? We're hearing so much more about that in the news now. What does that mean?
We are. So breast density is a phenomenon that we can determine based on, it's based on the appearance of your mammogram. So how much of the fibroglandular breast tissue is visible on the mammogram. So women with more than 50% of their mammogram sort of covered by that dense fibroglandular breast tissue qualify as having dense breasts. And that's important for a couple of reasons, because it does make the mammogram a little bit limited, because the dense breast tissue appears white on the mammogram, which is just a black and white picture. But breast cancers also appear white. So when there's a lot of that dense breast tissue sort of covering the breast, it can hide breast cancers. That's been improved some with the 3D mammography that is now standard, but it is still limited in women. But the other less well-known issue with dense breast tissue is that it actually is a risk factor for breast cancer. So we know women with dense breasts are actually at higher risk for breast cancer. So it's a bit of a double-edged sword because they are at higher risk and it does make their mammogram slightly less effective.
So how do you know if you have those? Is it just because the breast is thicker?
No, so you can't. It's not something you can determine based on how the breasts feel, or their size or shape or anything like that. It's strictly a mammographic phenomenon. So when you have your first mammogram, that's included on every radiology report. And now actually it's federal law. We've been doing it for years, but it's federal law that breast density information must be included in the letter that you get in the mail after your mammogram that says you either do or you do not have dense breasts, and then would make some recommendations about if you do have dense breasts, what might else we want to do to help add accuracy to your exam.
Now, the traditional machine that we use when we go in for the annual mammogram, is there another machine?
So
something different?
The mammogram machine that we use now should be standard anywhere you go for a mammogram, should be a 3D tomosynthesis mammogram for your screening. And that, still looks and feels like a traditional mammogram. In ladies with dense breasts, we recommend that you also have at least a screening ultrasound. At our facility, we do use a separate machine for that. That is called ABUS, which stands for Automated Breast Ultrasound. Traditional handheld ultrasound, like you've had sonograms of other parts of the body, also works, but we like the ABUS apparatus that is built and designed specifically for dense breast screening.
Well, let's talk a little bit about the buddy check and feeling for lumps yourself. It's important to check and know your body in case you feel a change, correct?
Correct, absolutely.
Will it feel like a lump? Like we say, there's a lump. I mean, is it going to feel like a little knot there?
It can. Sometimes, women will, it depends, it can feel like different things. What is most important is that you practice regular self-breast examinations. We say once a month. Generally, if you have regular periods still, the week after your period is kind of the best time when things are the least lumpy and sore. But really, as long as it's kind of around the same time every month. So, you can set a reminder in your phone. You can mark it on your calendar. You can, yes, use the 13th of the month. Absolutely. And so that you have an idea of what's normal for you. So if you feel something that feels different, sometimes, it can feel just like a firm spot or an area of thickening. Sometimes you'll notice some dimpling on the skin. That's less common, but, and sometimes it does feel like a little P or BB or knot in the breast. But the most important thing is that it feels different than usual and different than the rest of the breast.
What about pain? Would you feel any kind of pain?
You can. And certainly breast pain is very common. It is likely not typically associated with breast cancer, although, occasionally it can be, but typically cancerous lumps that women feel are painless.
Okay, what about men? I know they're only 1% of the equation, but I've interviewed a couple of men over the years, and it's important for them to kind of keep a check on their body too.
It is, absolutely. We don't routinely use mammography to screen men, especially men at average risk, but, a self-exam is still important, because you know your body better than anyone. So if you notice something that seems new or out of the ordinary, we always want to get that checked, and that, may involve a mammogram. For a man.
Maybe wives or sisters or moms might have to push their loved ones.
Yes, gentle reminders.
Yeah. Because do they use the same machine for man? Because, their chest is flatter.
We do. Yeah.
Yeah.
Like I said, the mammography technologists, that's part of their training, and they're able to get beautiful images on anybody who walks through the door.
Now, when you look at these, you see a black and white, it's like a black and white x-ray, correct?
Correct.
And so you can tell from that, you have a trained eye then to look for something out of the ordinary.
That's right.
All right. And then how long does it take? Like if you saw something, how quickly do you let the person know, the patient?
Those results go right back to their doctor. And we also send the results in the mail, which obviously takes a little bit longer. But these days, almost everybody has access to their electronic medical record. So as soon as that report is available,
so you can see
it's available online in your portal. And then it also goes to the doctor, but there are multiple ways that patients can be notified of their results.
Because the reason for getting the first one at 40 is what they call a baseline.
That's right.
So you have something compared to as a woman ages, correct?
That's right. Because your mammogram, is unique. I liken it to your fingerprint. Mine doesn't look like yours or like anyone else's, and so it's very important to have prior exams to compare because we're looking for subtle changes. Sometimes it's not a very obvious lump. It just you'll notice just the quality of the mammogram or the density in a certain area looks different than last year. And that sometimes is the tip off that we have to investigate further.
What made you become a radiologist, get into this field?
I had some unique experiences in medical school where I was able to observe radiology. I was at the University of Florida at Shands, and watching the radiologists perform procedures, the image-guided procedures, which is, how we do breast biopsies as well, was fascinating to me. And I thought it was really interesting that you could sort of look inside the body with all the technology that we have and then use now more advanced techniques to do procedures that used to require a trip to the operating room with general anesthesia and a big incision. And now we can do so much of that with the patients awake, with needles, with minimal downtime and much less invasive. And I just, it fascinated me. So
now, if you see a lump and someone is diagnosed with breast cancer, they're finished with pretty much the radiology and the mammography, or is it possible you have to go back and get more of that?
Sometimes they do. Part of the, when we do a biopsy and identify cancer, a lot of times patients will undergo a breast MRI, which is a specialized test that sort of, can sometimes uncover some additional areas that might need to be addressed, because we want to make sure before a woman goes to the operating room to have her breast cancer removed that, that there aren't other areas that need to be removed. Our goal is to send patients to operating one time to have the right surgery the first time. So sometimes that workup does involve a few additional steps to make sure that the cancer we've identified is the only cancer that needs to be addressed.
What's the biggest change you've seen in your career so far?
The 3D mammogram is new since I became a breast radiologist. That was something that I learned on the job at Bay Radiology, which I've been in practice for 11 years, and we've already got, new emerging modalities that we're adding. And I think that's part of what makes medicine and radiology interesting, is that, we're always learning and evolving and just trying to make sure that we're offering patients the latest, most advanced technology, even right here in Panama City.
Right. And of course, early detection is key. It's always most important that they catch this quickly. Correct?
Absolutely.
Right. We don't want to wait until we're down the road, because some are aggressive. Some breast cancers are aggressive. And there's a bunch of different kinds. Is that correct too?
They are, yes. And what we hate to see is when a woman comes in and either has never had a mammogram or hasn't had one in many years and has a large breast cancer, that's going to be much more difficult to treat. I mean, we obviously don't like to see breast cancer in anyone, but we know it's very common. And so when we can identify breast cancers that are brand new since last year, or just a couple millimeters in size, that patient is going to have to go through some surgery, and minor treatments, but the treatments that they have to endure to be cured of their disease are much, much less invasive and less arduous than more advanced cancers.
What's your best advice for women?
Have your annual mammogram. Don't delay. Don't be afraid. We like to tell women you're much tougher than you think you are. And a mammogram, in the grand scheme of things, is really no big deal to really ensure your long-term health.
All right. Always great advice. Always informative. Dr. Lindsey Weintritt-Davis, it's always good to have you on the program. Thank you for coming in.
Thank you so much.
Before we leave, just a quick note. We have been covering buddy checks here at News 13 for over a decade. And it's been an honor to be the face of Buddy Check, if you will, to remind women each month to feel for lumps and to get those mammograms. This will be my last interview. We've been doing them almost 4 years monthly with survivors and with Dr. Lindsey and with surgeons and with nurses and folks from the health department and everyone who has shared their journey. We appreciate them so much. So I just wanted to say thanks for that. Thanks to Dr. Lindsey Weintritt-Davis. And very quickly, I have to thank the guy behind the scenes that you never get to see. Spencer Phelan is our News 13 digital desk executive producer and director. And if it wasn't for him, we couldn't get these things on the air without him. Come here, Spencer. I know he's going to kill me, but I just have to say thanks. Little cameo. Thanks, buddy. And that's it for now. And just because you don't see my face, stop it. No crying. Doing the buddy check. It will still remain here at News 13, and I'll be checking at home. So you promise me you'll be checking along with me, okay? All right. Thanks for watching, everybody. Have a great weekend.